Well, this is obviously a big change for our students, and there's a psychological aspect in physically returning to the classroom.
Plus, parents have concerns about their children's health with the Delta variant hitting kids more frequently than last year's coronavirus. So joining us right now to discuss those issues are Dr. Margarita Samova, a child and adolescent psychiatrist with Kaiser Permanente, West LA, and Dr. David Bronstein, a pediatric infectious disease physician with Kaiser Permanente out of Antelope Valley. Welcome, both of you. Thanks so much for being with us today.
Thank you.
Dr. Samova, we'll start with you. For at least a year and a half, kids didn't have that routine of getting up early, getting dressed, and getting themselves to school, and now they may be finding it difficult to do so. So how much of a psychological jolt is it to change their routine?
Well, there is definitely a difficulty, and no one can deny it. Every single family is feeling it right now, families who have children. The good thing is we go through some of it every single year when children do go back to school. So many parents do already have some routines in place, at least to prepare kids for the change in the routines. So usually a couple of weeks before the school is supposed to start, many families are already trying to put a different bedtime in place, trying to make sure that children do go to bed earlier, so they wake up earlier, so they stay up throughout the day. Especially our teenagers sometimes have a really, really difficult time doing that, and spending lots of time at night on the phones. So a lot of that, I think, is being offset by just the yearly practice that many of our parents do have already, but definitely COVID is not making it any easier. Unfortunately, this year just has been much, much more challenging because of the COVID aspect added on the top of everything else.
Dr. Bronstein, what do parents need to know about transmission of COVID with younger children who are not approved yet for the vaccination? You know, we've been hearing a lot lately that the original strain of the coronavirus was less transmissible, and now we're hearing because that children were actually isolated for so long, that's why those numbers weren't there. Now that they're out and about, we have a Delta variant that's more transmissible. What do parents need to know?
Yeah, you're absolutely right. The Delta variant is significantly more transmissible, and unfortunately, the vaccine has not yet been approved for kids under 12. Now, for anyone 12 and up, hurry up, get the vaccine. That will protect you. It'll protect you from severe illness and awful things that can happen. For kids who are younger, though, obviously the vaccine isn't there, and so it's just so much more important to follow the rules that will help keep you safe. So wearing the mask in school is tremendously important, and not just wearing it, but wearing it correctly. And I know, just talking to my own kids who are 10 years old and 13 years old, their teachers are very careful to make sure that the kids are not just wearing them, but wearing them correctly. Schools are doing their best to keep kids safe, and I'm comfortable having my kids in school knowing that they have good ventilation, they have good filtration systems. And most importantly, the schools have a system for if somebody does test positive, they know what to do ahead of time in terms of isolating them and making sure that we're not having continued exposure over and over again. So I think school is actually one of the safest places that kids can be right now, as long as the rules are followed appropriately.
And that is so great to hear. Dr. Samova, back to you. Of course, it's overwhelming for some kids who've been homeschooling or using Zoom to go to school. To dive back into this intense social aspect of school, what kind of anxiety does this kind of create for kids, and what can parents do and look out for to ease a bit of that anxiety?
Yeah, so definitely anxiety of going back is unavoidable, and it's different for different age groups as well. We do have some kindergartners or first or second graders who go back to school maybe for the first time because they had to spend the first year, first grade, all online, and now they really need to transition to a different setting altogether, meet new friends or new teachers, new setting. Same applies to maybe middle schoolers and high school students who also transitioned maybe during the COVID year to their 9th grade and never ever met their classmates or teachers before, or never been on a campus. So a lot of it, anxiety is an anticipatory anxiety, as we call it. So it's sort of normal to expect some degree of anxiety that might happen there. But it's always helpful for the parents to maybe try to facilitate as much open conversation as they can with their kids, especially the first day is over. So it's good to ask children, okay, how did your day went? What was exciting? So can kind of trying to be very, very positive about what was good at school and focus on those things, rather than maybe ask the leading questions such as, are you anxious to go back to school tomorrow? So that will only show kids that there is something to worry about, and that's something that we don't want to happen. Try to stay calm and maybe model as much as confidence in the process as you can.
Yeah, that's really good advice. Dr. Samova and Dr. Bronstein, thank you for your time today, and thank you both for your insight. We really appreciate it.
Thank you.
Thank you.
Thank you.